Great. Thank you, everybody, and thank you for coming, and thank you for the invitation. I work at the University of Sheffield, and I do research on food insecurity. And can I just check that everybody can see that slide presentation?
Yes, we've got it.
Fab. So what I'm going to do is kind of add a bit of context and background to some of the stuff that both Kate and Mark have been talking about today, talking a little bit about the different roles that food access or food support and food aid provide to people because they meet different kinds of needs. And you can get different kinds of outcomes from them depending on the configuration or the ways in which you mobilize that food. All right, so I want to start just briefly by talking about food insecurity. And, we talk about food insecurity or food poverty all the time. But there's, again, Mark mentioned language issues. There's a kind of inconsistency around the language. And one of the things that we tend to focus on, or what has become to the fore, is this notion of affordability. And indeed, that is a very important component. Income matters in terms of being able to buy food or being able to not compromise on quality of your food or even not have to worry about food. So yes, it's very important, but it's not the only thing that contributes to food insecurity. Food insecurity is also about access. And so is there healthy food in the place where I live? And it's also about capability. Do I have the skills to be able to do the things I need to do with the food that I've got? Do I know how to cook it? Can I physically open the jars, or can I physically cook the project? I might not know how to do it, but I might not be able to do it. And do I have the mental space to really balance all the competing stuff going on in my life? And of course, these three areas overlap with each other. Having for those of us who are better off, we may not have the capability and we may not live near a supermarket, but because we are better off financially, we're able to throw money at the problem, which doesn't solve our problems about being able or capable. It doesn't improve our access to food, but it certainly doesn't make it as much of a problem as it is for people who are struggling particularly and stressed about their incomes. And we've seen that a lot during COVID. I guess my point here is that food insecurity, throwing more money at people isn't going to just address all the issues around food insecurity. It just, it will help, but it's not the whole answer. The other point with this slide that I want to kind of mention is that food insecurity comes at different levels. So we have people who are severely food insecure, which are the people who are in crisis. And those are the folks that Kate is supporting. And these people absolutely need somebody to catch them and keep them from falling through the net completely, like the man that she mentioned. We also have areas of moderate food insecurity. And this is where we get that kind of paradox of why is it that people in very low income communities also those are places where there are higher rates of overweight and obesity. And there's some very logical reasons, which I won't go into now, but there's some very logical, very rational reasons why people would choose the 1 pound frozen pizza for dinner over the more expensive budget meal from the Tesco website of chicken and cauliflower. There's some really, really good, important reasons for that. And of course, we know from research that to eat according to the Eat Well plate, somebody on the bottom fifth of households, bottom income fifth of households in this country would have to be spending half of their after household income on food only. And of course, the after household income is the stuff that you pay for your phone with, which we now have to have. It's part of the urban infrastructure. It's your clothes, it's transportation, it's the electricity, it's any entertainment that you have, it's any issues around things that get broken that you need to repair. So of course, people don't have half of their income, half of their disposable income, or half of their post-household income to spend on food. And of course, the more wealthy you are, that proportion of your income goes down. So the proportion for most of us is around 15 to 20% as opposed to 50%. All right, so food insecurity, the drivers of food insecurity are multi-scaled, multi-dimensional, and they overlap. And they reinforce and feed into each other. Food insecurity also has effects. So it's not just what causes the insecurity, but also the effects of the insecurity. It in turn causes further issues, which then feed. So there's this kind of recursive relationship. So people have reduced social networks. Somebody told me one time, if you've not got money for food, you've certainly not got money to socialize. The number of people who said before I began and joined in with this community project, I would just sit at home all day, feeling lonely and isolated. There's a reduced ability to rely on others then in terms of times of need. You haven't got social networks who can help you if you need help, either with the capacity issues or your access problems. So one of the things we saw during COVID is quite a large proportion of people had enough money to buy food. They didn't have anybody they could ask to go shopping for them. Of course, you also have the stress, reduced social networks, impact on your mental health. Humans are social beings, and we certainly know that that isolation component is an important one. The NHS spends about $2 billion a year addressing, or we spend about $2 billion a year through the NHS addressing health-related issues through social isolation. And of course, in the bigger scheme of things, we end up with community disillusion. If you live in a place where there are lots of people who are socially isolated, there is no community connectivity. People are afraid of their neighbors. There's increased amounts of crime and so forth. The other effect of food insecurity is poor diet. So we spend $16 billion a year through the NHS on diet-related poor health. Before COVID, this was the biggest point of expenditure in the NHS. We also see at household scale people narrow their diets, or they contract. Fewer and fewer items become part of that diet. And along with that, we get a loss of food literacy. So reduced capacity, reduced understanding of what certain food items are. I've talked to people about, their children who don't know what grapes are, or people who have never tried parsnip before. And these are, it's completely understandable why you would walk past that aisle. It's risky food. It goes off quickly. People might not like it in your family, so there's the stress of that. It doesn't necessarily fill you up. And of course, as people are retreating from these healthier options, they disappear from our foodscapes or our food landscapes. The supermarket no longer sells them because nobody's buying them and they can't make a profit on it. So it just disappears out of the spaces where people live. As a result, then, of course, we have that returning relationship in that people in that place no longer have access because that food is not available in the places where they live. And we end up with low quality foodscapes, sometimes referred to as food deserts, other times referred to as food swamps. But either way, they're low, have low nutritional quality. And of course, then linked to this further, there is an increased mental load. So there's stress around being able to access food, knowing that you're struggling to feed your family, feeling that you're failing to do something that you thought you were going to be able to do. So there's lots of stress, mental stress, and people talk about that mental stress a lot. There's household stress around meals, and people fighting, not wanting to eat the same tin of beans again. Beans on toast or beans on a baked potato, again, is kind of too much. Feels the stress around trying to create healthy meals on a very limited set of options. Absolute fear of waste leads to reliance on these safe foods. And then people describe themselves as stressed, stretched, and struggling. And it's interesting, very, very rarely do people talk about themselves as being in poverty. They talk about themselves in terms that we all probably can relate to at one point or another, as stretched, as stressed, and as struggling. And of course, these kind of effects, these kind of combinations of things have wider effects. So there's an inability when you're kind of under this pressure, there's an inability to participate within wider society and normal things that we see of as expressing British values. So participation in environmental issues becomes increasingly more difficult. It's out of it's the last thing on your mind is buying organic food, because you can't even afford to buy the regular stuff. It's all about what can I get the most for. Healthy eating also tends to go out the window. People try, they do it relationally. They figure the frozen pizza is better than the micro burger, for example, and that fits within the constraints of their budget. And then also around, they struggle to be able to express shared values such as care and thrift. And people want to do this. It is a British value to be able to express thrift and good stewardship. And it's also a value to express care for others, care for your neighbors and so forth. But because that lack of social context, because of lack of finance and so forth, and the stress and the poor diet and the health-related issues, those kind of wider engagements become less and less possible. All right, so I just want to, in my next slide, talk a little bit about surplus food support. I'm here going to talk a little bit more, not about the food banks, because we all seem to know what food banks are in one form or another. What I really want to talk about is all the other food activity that goes on out there, and there is a lot of it. So we tend to think that all food support is actually food aid in the food bank sense, when actually that's maybe about half of it. And on top of that, many organizations do multiple things. So they may have a food bank on a Thursday, and they may do a pantry on a Wednesday, and a children's supper club on a Tuesday and a Friday afternoon. So they pack out their time with different sets of activities. And each kind of activity does a different thing. So I did a bit of work with Mark doing a survey of those who use the Bread and Butter Thing project, bearing in mind that this is not a charity. It's food that is donated. It's not donated, sorry. It's food that would have otherwise have been gone to waste, and it's been diverted into the social sector. Many of these models have fewer barriers to entry than, say, some of the food banks, which, because they're for people who are in crisis, you have to demonstrate that you're in crisis. And I'm not criticizing here. I'm just saying there is a demonstration effect that also creates a stigma associated with having to admit that you've failed. Many of these other projects are just area-based, and anybody who's in that area can go to them. These are also not emergency situation solutions. People tend to pay for or provide a service in exchange. It's really a hand up. So it's support, not a hand under. And it can reduce the vulnerability to emergency need because it catches people before they fall. It helps build those social connections and so forth. But some of this depends on how you frame it to your communities. If you frame it as charity, it comes across as charity. As you frame it as a community project, then it's a community endeavor. So just moving on, I want to really focus on the pantry model. I won't go into the other bits of this. But in terms of we surveyed people who go to the Bread and Butter Thing, and many of them responded that they had a reduced mental load as a result of being part of this project. 72% reported that they had less stress around food, and 73 reported that they had increased enjoyment. So their relationship with food had improved. There's better food literacy around what foods are and an opportunity to try and experiment. Budgets are being stretched. There increased and improved nutritional quality of diets. People, 82% said they were able now to include fruits and vegetables in their diets. They expanded social networks, and this I think is really important. 40% of the respondents said as a result of going weekly and collecting their food back, they felt less alone. That's a direct outcome. And they also know their neighbors more. So we know that again has bigger ongoing effects. People are connected. Communities are reconnecting through projects like this. 32% say they now know their neighbors. There's reduced fear and increased sharing. So people talk about sharing with their neighbors when they have something they don't like. They share tips and information about other services and where they can get support. They even start their own groups and check in on each other to make sure people are okay. This sort of project allows wider participation in wider British social values. So people talk about being, all of a sudden they're able to engage with those issues, like we are helping to reduce food waste. And then also the diet diversity that's happening is part of it. It's a sustainability issue. If we're going to be sustainable, we need a more diverse diet. Same with thrift, and then same with improving their food. And I realize I'm going on and on, so I'll kind of just move on. Finally, also, they do help, these projects help repair foodscapes because they help to create demand and understanding about the foods that people don't have in their place. And 3 out of 4 people who go to the bread and butter thing again said they would eat the new things that they tried again if money were no issue. Other activities have other ways of supporting foods or of kind of building some of these things, but they all kind of different. How you configure it does it all a little bit differently. All right, so I guess I want to leave you. My big message is this. It's not what it is, it's what you do with it and how you embed it into places that creates different kinds of outcomes for different kinds of people. And I'm just going to end on this rather complex slide. Rather than talking through it, I'll leave it for you. But what it is, I have a framework that I developed from research that I've done with huge numbers of different people and organizations about how different projects, what kind of outcomes can be achieved. So we do need catching. We've always had food banks. We just haven't always had them to the extent that we have. We need also that middle space around capacity building. And we also need to think, how do we transform? What would transformational kinds of activity look like? And I don't think we really have that last column sussed entirely yet. So I'll end there. Thank you all, and try to figure out how to stop sharing.